In the next 5 minutes, we'll uncover information that could change everything you thought you knew and the real risks no one is talking about.
Again, especially for, pregnant moms, I'm just going to say it again. It's super, super, super important that moms really focus on improving their own health before they take on the responsibility of developing another healthy human, right? Reducing inflammation in the body, putting any existing autoimmunity into remission, because autoimmunity creates inflammation, right? Measuring and correcting any nutrient deficiencies. We mentioned one or two. Choline is hard to measure, but folate is measurable through blood labs. Doing some detoxes in order to reduce your total body burden of toxins and things that will otherwise be passed on to the baby. Because as moms, when we nurse our babies, which is the most healthy way to feed a baby, but we store our toxins in our fat cells. So anything we've been exposed to throughout our life that we weren't able to get out immediately, our body stored them into our fat or in our bones. And so when we break down our fat to feed the baby, those toxins can be released and they can be fed to the baby. So if mom is able to do some healthy detoxes prior to conception, you can help get your body clean so that you're not passing on those things. I mentioned choline, I mentioned folate versus folinic acid in pregnancy. Other things to consider that are critical are B12. Again, folate doesn't work without B12 in those pathways that we talked about. When folate is converted into methylfolate, it has to work with B12 in order to make the methylation pathway for DNA production and repair to work. And if a mom is vegetarian or vegan, she may have lower body stores of B12 and she may need some additional B12. That's also something that can be tested through blood labs. There's two forms. One is called B12, the other is called methylmalonic acid, okay? And again, if a mom has been in an autoimmune condition, her body has had autoimmune inflammation, she may have developed parietal cell antibodies or intrinsic factor antibodies, which can cause pernicious anemia, where her body stops absorbing B12. So super important that the B12 is measured and assessed. And the other one is a little more complicated, but it's tetrahydrobiopterin or BH4. We don't currently have labs to measure it, and it is harder to correct, which is why I focused so heavily on these other steps, getting the inflammation under control, getting the choline, the methylfolate, and the B12 in order, because again, they make the tetrahydrobiopterin. So if you fix all those steps, your body can handle it. You don't have to per se worry about it. Some of our bodies have a harder time making BH4, so we have to stay super clean. But again, BH4 is a cofactor for nitric oxide, and it's how we move oxygen around our body, and it's important in order to specifically be able to get blood flow to the placenta. So having low BH4 can lead to, call it uncoupling of the nitric oxide, which creates more inflammation in the body. It becomes like an inflammation spiral, and it can lead to preeclampsia or intrauterine growth restriction, right? Small baby growth, because the mom's body doesn't have enough BH4 to send the blood supply and things to the baby. So those are things that we can avoid by, like I said, taking care of the other things and getting mom healthy.
Would you say that it's also useful to avoid fortified foods that are fortified with folic acid? And I believe some people know what those fortified foods are, but for those who don't, can you just, give some bullet points?
In the US, most breads, many grains, crackers, rices, you have to read the label. And if it says fortified at all, it means that synthetic vitamins have been added back into the food. And if it's added into the food that way, it's usually that folic acid that we talked about. But it can also be found in energy drinks, which I hope no pregnant women are drinking anyway. Could be added to some juices and things. Just start reading labels. And anytime it says fortified, you need to think folic acid. And anytime you read like a vitamin bottle or something and it says folate, if it just says folate, you can almost expect that it's from folic acid, right? Unless it says folate, parentheses, 5-methyl tetrahydrofolate or methylfolate or folinic acid or calcium folinate. Folinic acid is also called calcium folinate. If it doesn't have any of those names that are good, you have to assume that it's the folic acid, because I've caught many companies that just write folate on their product. And if it's not greens or lentils and it says folate on the bottle, you know they've had to somehow get it into that bottle. And it's almost akin to asking a woman, would you go out and forage dead leaves for your meal? No? Well, then why would you want to eat that synthetic vitamin? Do you see what I'm saying? It's like our body's like, oh, no.